You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, nutrition, and sports performance. Stay up to date and listen anywhere, anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your hosts, Dr. Justin Marchegiani and Barris Harvey, as they answer your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Thank you guys for tuning in to another episode of Beyond Wellness Radio, here with Barris Harvey, myself, and the man, Dr. Justin Marchegiani. How's it going today, Doctor?
Great, Barris. How you doing today?
I'm doing very well. In this episode, we wanted to make sure we nailed down the functional movement. Now, it's really dependent on the goals that you have and what you're training for, but as a personal trainer myself and as a functional movement guy, Dr. Justin, I'm pretty sure we've both seen a lot of people come into our practice just training their butts off, but they're just not doing the right things, and they end up getting themselves hurt.
Exactly.
So today, we want to focus on making sure we're doing we're putting that energy to resourceful and making sure that we're going out there, we're working hard, but we're working smart. And one of the biggest things I see, and this was even myself, and when I was playing football, I'm still playing football, but before we had a whole different program, and we would just balls to the wall, bust our ass, and train as hard, but there wasn't as much emphasis before on efficiency, and that's one of the biggest things. So, Dr. Justin, could you just tell me how many people that you see when they come to you and they're training and they're athletes? What's just like the average body position and posture? I mean, I'm pretty sure you see great athletes that could just be even better if they can just put themselves in the right position.
Yeah, it's a great question, Barris. I actually, just 2 weeks ago, I treated a two-time gold medalist sprinter, and when I tested his muscles, he had both of his hip flexor muscles up in the area called the iliacus, up in the hip flexor area, turned off. And I was able to apply force, and he could not match my resistance. The muscle was literally turned off from a neurological standpoint. So his ability to absorb force and perform won't be there. So most individuals, I find, have a muscle imbalance, and even if they're exercising or training well, with that imbalance, injury can happen. And one of the biggest imbalances that I see is called lower cross syndrome. Mm-hmm. And what lower cross syndrome is, it's just a big fancy term, but essentially it means the muscles of the hip flexors, it's called the psoas muscle, is really, really tight, and the upper back muscle in the erector spinae is really tight as well. And then on top of that, on the flip side of the lower cross, we have weak muscles in the lower abdomen area and weak muscles in the glute area. So a lot of the muscles that cause hip extension are really, really weak, and all the muscles that cause hip flexion are really, really tight. And so what this does is it puts more of any extension movement, any type of movement in athletics usually involves a lot of hip extension. And what happens is the hamstrings and the hip flexors, or the hamstrings and the lower back muscles, do more of the hip extension and not the glutes. And then a lot of injuries happen from that biomechanical compensation pattern, just looking at the lower body. There are more outside of that, but just for the lower body, that's one of the biggest kind of compensation patterns that I see.
Yeah, I've seen the same thing too, and it's important, especially even for the young personal trainers out there. A lot of personal trainers, they'll go through the program, even the ones with degrees, and they'll go and they'll just take just a basic generic exercise, but they don't focus on, well, where are you weak and you need to improve your strength and your endurance, and where are you tight and where do you not need extra training. I've seen people that have extremely strong chest muscles and they have rounded shoulders, look like they were sitting on a computer all day, and most of us are. And it doesn't make too much sense to not pay attention to your more of the posterior muscles, more of the thoracic movements, and instead a lot of them, they just hop on the bench press and just further that imbalance. Are there any specific, I know I mentioned one with the computers, but are there any other ideas in why we might have this problem that's so prevalent?
Well, Essentially, we're in this flex position all day, right? We're at a computer, our shoulders are rotated forward, our hands are then pronated downward, so our shoulders rotate even more. So we have all this, looking at it from an upper body perspective, we have all these tight chest muscles, we have these tight upper neck muscles, and then we have these weak muscles in the back of our scapula, and we also have really weak muscles in the front of our neck called our deep cervical flexors. So then we're kind of like a beak-like position, like a hawk, if you will, kind of protruding our head outwards while our shoulders are rounded over. And so we have this upper cross syndrome with all the tight upper neck and chest muscles, and then we have the lower cross syndrome with the tight hip flexors and upper back muscles, and it really creates a pretty bad compensation pattern and an increased risk for injury. So anytime someone's training, one, you want to address those postural deformations, because that's going to just prevent injury. And then once you have that addressed, then you can do the best movements that I find will increase your metabolism and make you more functional regarding how you move.
Yeah, exactly. Back to the lower cross syndrome, an idea, and of course, driving all day, sitting in school, sitting at work is an obvious way to shorten the hip flexors, weaken the core. And an exercise that we've been doing of late in my football training is basic, breathing and pushing out to make sure we have that transverse abdominis activated, and we're getting that pressure, that abdominal pressure from our just breathing in appropriately. How many people do you see that that don't have their abdomens turned on? They can't flex it even if they wanted to.
Great question. So a lot of people do have their abdominal wall turned off. There's a couple ways you can assess this. Again, faulty movement patterns are going to be a main way we see that turned off, right? They're just sitting all day. So getting up, getting a foam roller, and we'll go into some of the ways to address this, but a lot of times stretching necessarily isn't the best way. But getting up, literally putting your backside against the wall, literally standing against the wall, put your head against the wall, followed by your shoulders, butt, and heels. Your eyes should be forward, not tilted up, so your jaw should be level with the ground. And then you pull your shoulders and everything back against the wall, and you literally sit there for a minute, and you'll find how hard it is just to stand there against the wall. And when you walk away, that kind of gives you a biofeedback of what standing up straight really feels like. And I start my day, for the first minute of my day getting up, I literally get up against the wall for at least 1 minute, and then 2 to 3 times throughout the day, I'll stand up against the wall to kind of get biofeedback of what sitting up or standing up straight feels like, because your brain totally loses that sense of what straightness and good posture should be like. But essentially, if you look at someone on a plumb line, you should see their external auditory meatus, or the hole in their ear, line right up over their shoulder over their hip over their knees somewhat, maybe with a slight bend, and then over their ankles. And that should be what good posture should be. And what you really tend to find is if the ear is in front of the shoulder in that forward head posture, everything tends to go south from there. Because everything else is a compensation pattern or a distortion from that first domino not falling over properly.
And couldn't that also come even from lower body problems? A lot of I tell a lot of people that if just for human survival, your body will do anything to compensate in order to keep your head straight. So if your shoulders are messed up, your hips are messed up, it's going to further compensate in order to keep your head, or even if you're, like you mentioned before, if your head is maybe bent at an angle, maybe your hips or your knees will compensate in order to keep that strengthened, and it, like you mentioned, just trickle down. One of the problems that I had when I went to you noticed that my ankles, the flexion in my ankles, weren't as good as they should or could be. And I actually had one leg, and that was the same leg that I got injured on, that wasn't great at absorbing force. Now, we see a lot of people maybe training the inappropriate way and getting injured, but what about just maybe out on the field? And you mentioned how force absorption could contribute to injuries.
So essentially, your muscles are like shock absorbers. They're designed to absorb force. So if you have like a bicycle or a car that doesn't have the tires filled up, right? The tires are designed to absorb force. So the tires, then force goes to the axle and the suspension system. And the goal is if you have good tires and good shocks and suspension, then the sensitive structures of the car aren't going to take the beating. But if your car's out of whack, maybe the alignment's not correct, right? Or maybe the tires aren't full, or maybe you're just riding the car on the rims, you're going to create serious damage to your car. And it's the same thing with a person competing in an exercise. Whether they're sprinting or doing marathon training, whatever it is, there's change of direction happening in the body, and your body has to absorb that force. And if force absorption is impeded by the body, let's say there's instability in the ankle joint at that tib-fib joint, that's going to create force absorption problems because the body is designed to create compensation patterns. A compensation pattern being maybe a limp, right? If everyone can kind of think back to a time where they maybe rolled their ankle and what happened? They started walking with a limp. That's a compensation pattern. Your body uses the nervous system to kind of guard and shield things to prevent further injury. So let's say at some subatomic level, neurologically, that's still happening. And your body's turning off certain muscles because that compensation pattern's there because the body's not quite 100% in balance. Well, it's going to be really hard for you to heal because force absorption is not where it should be. So the goal is to assess someone, make sure they're able to absorb force properly. If they can absorb force, then the next phase is, all right, now let's get the right training dialed in. And again, there's 3 types of training. You're training to look good, you're training to perform well, which could be sport specific, and you're also training to feel good. Again, my number one reason why I exercise is not because of looking good. It's really because how I feel, and also because of the brain-derived neurotrophic factor that helps my nervous system and neurological system work better. But we can go into that a little bit later on in the interview here, the podcast.
Yeah, definitely. I mean, I've read studies that showed you can exercise in the beginning of the day and it can curb sugar craving. So yeah, there's a lot to the feel good portion, and that's the majority. If I wasn't playing a sport right now, that'd be the reason why I would train, in order to stay healthy, but also to feel good. And there are times in the year that I specifically train and eat a certain way if I'm taking a photo shoot to basically look good and just for aesthetic reasons. I don't always feel the best when I train that way or eat that specific way.
Yeah,
But
typically, like when you're doing a photo shoot, you may go a little bit lower fat, maybe even low carb and low calorie during that time frame, just to really shred up faster. But long term, it's not a good thing. But it's all about what's your goal, right? What's the timeline?
exactly.
What's the end game?
So back to the absorbing force, this is a like eccentric strength, correct? Being able to lower weight or lower force generated, at least when it comes to the muscles.
Yeah. So think of there's 2 main ways the muscle work. It works concentric by shortening, right? Concentrate, shorten, or eccentric meaning elongate. So that's how a muscle either creates force through shortening and moving, whether it's hip extension or knee extension, like kicking a ball, that's a concentric contraction of your quad muscle, or sprinting, that's a concentric contraction of your glute muscle and hamstring. So yeah, and then when we absorb force, think about jumping, right? You're jumping off, let's say, some kind of step, and then you come down into a squat. Your glutes and hamstrings are actually elongating to absorb force. So the faster your muscle can elongate, it essentially takes that force off of potential ligaments, disc structures, cartilage structures. So the goal is in sports is not just to be able to make your muscles short and fast. That would be good for like moving fast. What good are you if you're fast but then injured, right? So we want to be fast but also injury proof. So you want to work your muscles concentrically, so sprinting and maybe plyometric work, but you also want to be able to work your muscles eccentrically.
Yeah, definitely. You're no good to your team if you're on the sideline, no matter how good you are. We started mentioning this word of turning on and off muscles, and I didn't want to get too far without explaining that just a little bit more, just in case our audience doesn't know what you mean by that. Could you go a little bit into what you mean with turning on and off muscles?
Great. So essentially your muscle when we test someone's muscle, it's not about the muscle being weak or strong per se. It's about the muscle being able to absorb force. So if I have your arm and put your arm out like at an angle and I press your arm down, let's say I put pressure on that arm over a 1 to 2 second gradient, and if your arm's strong, you're going to feel that force. You're going to feel a nice lock in that muscle. But if you can't neurologically turn that muscle on fast enough over that 1 to 2 second period, neurologically, you're weak. Now, that neurological weakness may not correlate to you doing, delt raises, but it correlates to neurological strength. Because if you can't turn that muscle on fast enough, let's say over a 1 to 2 second gradient, then you're going to get hurt.
Mm-hmm.
And then if you're actually performing well, you're not going to be able to absorb force again, which correlates to you getting hurt.
Yeah, definitely. Don't want people getting hurt. We want people to be able to train, and that's probably one of the biggest things that people stumble over. They hop in the gym, they start making progress, they get injured. And I mean, there's a lot of good athletes out there. There's a lot of good programs out there, in fact, and maybe people just jump in too early and they end up breaking their body down because they don't have that foundation set. They don't have their muscles turned on correctly. They're not in the proper alignment per se. And we can just take, even if it's not an athlete, even the average person, how many people do you see that come in to see you with perfect alignment? Now, we know that if somebody's coming to you, they're probably coming to you because they have a problem, but even you might have somebody coming with a nutritional problem, and you might notice they might have some motor skill problems.
Yeah, so typically I'll even see a lot of professional athletes that have distortion. So I saw that two-time Olympic gold medalist, two-time world champion track star a few weeks ago, and he had some muscles turned off, which, it's shocking. You think people at the highest level, should be in great shape, and a lot of times they just have great genetics, and they're great in spite of kind of their imbalances, not because of it. So again, there are a lot of athletes that have been treated by myself and other people that do what I do, that it's kind of taken their game to the next level. And a lot of times being an athlete, it's not even just about performing well. It's like, well, how can you just stay on the field? Like, let's say you can just keep performing the way you're at and not get worse throughout the season. Well, you're actually getting better because you're not on the DL. You're not on the bench, which is, you can't help your team from the bench. So your question was, if people that I see, how many of them are turned off? Well, a good amount of them.
Or actually, how many people walk in and see you? Because I know it's kind of a biased question, because people usually are coming to you because they have a problem. But how many people do you see that come to you that are perfectly aligned?
Very rare when it comes to perfect alignment. Very rare. So again, we want to test them and figure out where their neurological imbalances are, muscular-wise, and fix it. Not just at the muscular level, but at the nervous system level. And the next thing is making sure they have the correct movement patterns down. You should be able to squat, to bend, to lunge, to one-legged squat, to do all these movements with perfect form. And a lot of people have a hard time using perfect form when they're a compensation pattern. So a great way to make sure your form is great is starting with isometric contraction. So we talked about eccentric contractions, which is the muscle lengthening. We talked about concentric contractions, which is the muscle shortening. And isometric contraction is basically fixating your muscle, ideally at perfect form. The body likes 90-degree angles. So a squat, you'd have a 90-degree angle at the hip and the knee joint. A lunge, a 90-degree angle at the hip and the knee joint. And we'd want to have perfect form with those patients and then have them hold that position, ideally over 30 seconds to a minute onward, to make sure their form is perfect. Because if they cannot hold their form in an isometric contraction, meaning no movement, then they will not be able to do it when you add movement to it. So that's always the best starting point for people that don't have perfect form or are injured, like the ones that I mostly see.
Yeah, I think that's great. That's something that we've started implementing. We started implementing some of the Gray Cook stuff, the functional movement assessment things, to our football program.
And even like if you look at Jay Schroeder has a lot of great stuff on, his 7 isometric exercises. So anyone that's not really a good athlete, or maybe has, questions about them not being them not being 100% in balance and maybe their movement's not being right, just start with a good isometric squat. Get your hips down a 90-degree angle, get your quads down to about, parallel with the ground. Make sure there's about a 90-degree angle between your femur and your tibia. Have your toes pointing relatively straight, your hips and knees about shoulder width. Make sure your knees aren't collapsing, and hold a bar as you drop down into that squat position, and hold that position. Pull yourself into that position and hold it with really good form, breathing properly into the nose, out of the nose. That's a great start for anyone listening to this and wants to have perfect form. It's a great way to go forward.
I think it's kind of funny if you look at maybe other indigenous countries or even kids or little infants when they stand up or when they go into a squat to pick something up. That's like a resting position. They can hang out there for a long periods of time.
Yeah.
And it's difficult for a lot of people now just to even get into past parallel for a squat. Nonetheless, the ass to grass kind of thing.
Exactly.
So you mentioned training the nervous system. Now, that might throw some people off. Like, some people might be able to see, okay, I want to train specifically for hypertrophy and be able to put mass on, or I want to train for fat loss or muscle building, or I mentioned that, but strength or power. And you said something about the nervous system. What's different about just the usual, maybe what a normal person would usually do, go to the gym, just try to burn off some calories, quotes, or try to train the nervous system? What's kind of the different paradigms in those two ideas?
Well, when you're training the nervous system, there's a couple different things we're looking at. I use a bioelectric device called the ARP Wave. I call it the AMP Up. Stands for Accelerated Recovery and Performance, or Advanced Movement and Performance. And essentially, it's a bioelectric device that runs on a DC current, and it gives you the ability to scan what I call hotspots, or areas of dysfunction or inflammation in the muscle tissue. And what we can do is we can find out where those areas are, and then we can have people do those functional movements, whether it's a full range of motion movement or an isometric movement, and we can hit that area in the muscle or in the nervous system that's not firing properly while doing a perfect form, and we can help essentially neutralize that imbalance, which is pretty cool.
Yeah, that's awesome. I was able to use that, and I instantly was able to feel a change. I was able to go on the field the next day and just feel my whole body move more appropriately and more efficient. Is there a way that somebody can utilize technology either close to this or somewhat like this that might not live in the area of the facility in California?
Yeah, what I would recommend is reach out to my clinic. I'll be having certain units for rental. I know ARPWave Austin has a fair amount of units, and they do a lot of training down there. I think ARPWave New Jersey as well. There's a couple of people across the country, but I highly recommend that style, especially if you have some type of rehabilitative issue or you have a nagging injury. You want to get to the root cause. Now, if you don't have any pain or any imbalances that you're aware of, well, a good place to start would be just start doing some isometric contractions to start. Start practicing perfect form, and then once you feel like you have good form, then you can start incorporating full range of movements to a functional type of movement program. Pushing, bending, pulling, squatting, lunging, sprinting, kind of like the Paul Chek primal movement model. It's a really good model to look at things. I like isometrics, for form teaching, and then I also like isotonic movements for just functional movements as well.
Yeah, definitely. Now, Justin, maybe to give an idea out there, somebody who maybe they're an athlete, maybe they don't have a broken down nervous system, or they do. Maybe we have somebody who is broken down, or we just have an athlete who just wants to take their performance to the next level, train their nervous system to be more efficient, and they're not in California, but like you said, you're thinking about being able to bring those into your practice and running them out and training over Skype. What do you have like an idea how much that might run somebody?
Well, it depends. It's different for every person. I mean, if you have an injury, I typically only work with patients that have injuries. I have other people that I refer to that are more from the exercise performance side of things. But it's really different for each person. What I recommend, if anyone's got a question, they could always just hit me up on my website or schedule a complimentary consultation just so I can be more specific for that individual case.
Yeah, definitely. If anybody has questions, they can go ahead to the site beyondwellnessradio.com. Go to the contacts, and we have a contact box. So we're going to be doing Q&As as well on the podcast. So whether that be specific questions for this podcast, you want some resources, we'll have them already on our show notes, but there'll also be ways that you can contact us, ask questions, and ask the doctor really good, insightful questions, and we can go ahead and dive in on that. But back to the training. So I don't like sitting on the sideline. It's boring.
Yeah, so
right?
off the bat, kind of like with someone like yourself, right?
Yeah.
If you want to just start doing some functional things off the bat, is get a good isometric squat down. Make sure your form is good. Make sure you have someone watching you for the first time so you know that you're doing it right. Because if you think you're doing it right but you're not able to see yourself, then you'll automatically think you're right but you won't be. Start off with a squat, start off with a lunge. Those are the first two movements. Now once you get that movement down, you can kind of go into what's called an altitude drop. So imagine like jumping off a plyo box into a squat. So you're basically forcing your body to absorb force. Now imagine jumping off a plyo box into a lunge. It's the same thing. You're just trying to tell your body, absorb force fast, absorb force fast. And those are some simple things you can do off the bat, and then do it into a one-legged squat. And those are a good 3 movements to start with. Make sure your form's good with the isos. Once you're really comfortable and you can hold for 1 to 2 minutes with the isos and you know your form's good, then dropping off into 5 to 8, what I call altitude drops, is a great way to teach the body to start absorbing force. And you can do the same thing with a push-up. You can hold that push-up, drop down. You got a perfect form, though, for like 1 minute, and then you can do an altitude drop push-up where you press all the way up at the top, and then you pull your arms down and catch yourself at the very bottom of the push-up. You're teaching your chest muscles to absorb force really fast. So if you're a lineman or someone that uses their hands a lot, you have to absorb force with those chest muscles.
Mm-hmm. So like you mentioned, you would recommend somebody watch when you're doing a squat, because that's one of the most important movements we do as human beings, but because of a lot of the activities that we do in this 21st century, it's been created as a faulty movement pattern. A lot of us can't squat appropriately. Something that I have my clients do, or even myself, as I was able to develop and get into a really deeper squat and hang out there, was a simple thing you can do is grab the side of a door and just open the door so that way you have both hands on it, and try not to use so much of your upper body, but you can kind of get into the right position, knee straight, parallel. Some people might have to point the toes out slightly, but pushing out on the core, making sure that core is activated, trying to push the ass out, right? And then just going as far as you possibly can. I think one of the bigger things with people is that ankle flexion. Sometimes it's hard to get really low because they can't flex their ankles enough. Are there some ways that we can improve that? I have a couple, but let's see what you have in mind.
There's a couple ways. Ankle mobility is really important. It's kind of that Gray Cook, Mike Boyle type of thing where mobility at the ankle, stability at the knee, mobility at the hip, stability at the lower back, mobility at the thoracic, stability at the neck. So there's this kind of transition of mobility, stability up the spine. So it's really important because if that first domino of mobility isn't there in the ankles, then you're screwed. You're going to get injured. And you see a lot of basketball players, especially with knee injuries, consistently knee injured, and that's usually from an ankle mobility issue. Now remember, that ankle, though, can also be unstable too. So if the ankle's unstable, then mobility will be very difficult because the muscles get super tight around the area to try to stabilize things, and that's not going to be good. So one of the best things you can do for ankle mobility is you can put your foot up against the wall. So have your foot right up against the wall, and then you can literally press your knee inward and try to touch the wall with your knee while keeping your heel down. So you put your foot up against the wall, like your toe against the wall. So your toe's up against the wall, your heel's right behind your toe. And then you're moving that knee all the way into the wall while keeping your hips down, keeping your heel down. That's a great way on your own to get mobility in the ankle joint. Now, my doctorate's in chiropractic medicine, so I'm biased towards chiropractic or a good adjustment because I can get in there and I can adjust the navicular, I can adjust the cuboid, the calcaneus, the talus, and all of the metatarsal joints in the foot, very specifically. That you just can't do that with a gross mobilization like the one I just told you. But if you don't have that right now, that's a great first step.
Mm-hmm. Definitely. That's something that I do. I'll even sometimes just stepping on the floor and just kind of trying to get my knee, leaning towards the wall and getting my knee up to my toes and try to get it past my toes and getting, should I say, trying to dorsiflex it as much as possible. And I noticed we've been taught to run on our not on our toes, but on the balls of our feet, and that's been taught to a lot of athletes. The one problem gets to where a lot of athletes start to run, and they're focused on trying to drive the ball of their feet, but they're landing already, plantar flexed, so they're already ready to slam, but they don't have kind of the ability to absorb force and bounce off. Is that one of the ways people might get injured ankles?
Yeah, of course. So one of the biggest things we talked about, the ankle mobility type of drill that we just mentioned with the wall, and then also getting a really good chiropractic adjustment or manipulation. But also that tib-fib joint is vital. So if the tibia and the fibula meet right at what's called the lateral and medial malleoli, it's Latin for little hammer. So if you just run your hand down your leg, your lower part of your leg, and right where it hits the two bumps that form your ankle joint, the outside part of that's called your tib-fib joint. And if that's unstable, that can weaken literally all the muscles in your body. It's like it's creating that neurological reflex that's basically telling your brain to go into protection mode. So a lot of people continue to have that reflex because there aren't really good muscles that wrap around the ankle to create stability. So a lot of times we have to come in there and kind of create stability using artificial means until those ligaments can set and heal. So that's a big thing, that just because your ankle is mobilized, but if you have continued knee issues or ankle issues, you have to get deeper, more thoroughly assessed to make sure that ankle, that tib-fib instability isn't present.
Yeah, definitely. Since we're going on the ankles, let's go one step below that with the feet. We have so many muscles and bones in our feet, but oftentimes we have these shoes that really have high arches or a lot of protection and don't really let our feet get activated. What are some of the best things that we can do to kind of regain like some muscle memory and some activation in our feet, so that way we can have strong feet that are able to communicate with the ground and tell our body what to do appropriately?
Well, you're barefoot walking, that can always help, but we want to make sure you're in balance. I mean, if you have instability in the hip joints, that's going to create instability in the knee joint. That's going to cause what's called a valgus stress in the knee. It's going to cause the knees to kind of come together like knock-kneed. And if you just sit here like this, if you stand up and imagine just pressing your knees in, that's literally going to take all that stress and put it right on the arch of your foot and literally flatten your arch. So if you stand up with your feet together, just, hip width, toes pointing straight ahead, and if you stick your butt out, what literally happens when you stick your butt out is the weight starts going on the balls of your feet into the arches of your foot. So most people have that super, super tight hip flexor. That's going to take your pelvis and anteriorly tilt your pelvis. So imagine holding your pelvis like it's a bowl of water. Imagine tipping that bowl forward and the water dumps out forward. Feel where the stress on your foot goes. It literally will flatten down into the arch. So a lot of people that may potentially have a flat arch, it could be due to what's called a lower cross syndrome with the super tight hip flexors and instability at the hip joint, causing bad posture, which is shifting the weight, causing your foot to pronate or to essentially have the weight go from the balls of your feet to the mid part where your arches are. And you'll start seeing people on a plumb line, you'll see their hips and then their knees are inside of their hips slightly. And that's going to create a lot of the flattening in the arches of the feet as well. So it's not just a simple, hey, we got to throw some foot levelers on you. And that may be something you need to do, but it's actually get to the root of the issue. So find out where the muscular imbalances are in the hips, and then also assess the ankle and the feet, and then try to address the imbalances. That's a good first step. And then also, doing rolling underneath the foot can be really helpful, especially if the fascia underneath there is really tight and sore and inflamed. That can be really helpful to kind of loosen things up.
Yeah. So you said it's quite common when you have people with the Donald Duck posture, their hips rotated. What are some other ways that we can strengthen? Because I actually see a lot of people with flat feet and actually their knees actually coming in. Ways for them to strengthen those specific muscles in their quadricep, but also to regain the arch in their foot. Because even myself, I'm actually starting to get an arch in my foot just because of the knowledge and the things that I've been studying myself, and also that working with you. But I've been flat-footed for a long time, and I'm starting to get an arch. But I know so many other people that have that same problem where they're flat-footed.
Yeah, so what essentially creates the arch on the foot is your anterior tibialis muscle that wraps around and literally pulls underneath and literally pulls your arch into place. So that's the muscle that you would do, like if you are essentially standing up and you want to walk on your heels, that's your anterior tibialis muscle. So ideally you want to make sure there's activation of that muscle, but not to mention your hip muscles that also stabilize your knees. Because if your knee's unstable, right, that means your hip's unstable. If your knee's unstable, your ankle's unstable. So addressing the musculature that's going to stabilize your knee from your hips is really important. And what I would do is neurologically check the muscles individually and then use some type of bioelectric device like the ARPWave or the AMP Up to figure out the imbalances, and then ideally exercise that person with perfect form. Make sure they're doing a perfect lunge. Make sure they're doing a perfect squat, where that knee is right over that second toe. Where that lunge, that knee's over the second toe. And you're watching that person and you're making sure their form is not deviating. And when you basically provide the biofeedback of making sure their form is just right, and then they're already adjusted and fully in balance beforehand, and then you have the electricity going through, we can rewire that neurological pattern faster than just exercise alone.
Yeah, that's great. Is there any way that we can maybe even add some things beyond just the exercise portion? Maybe, and I know you mentioned the bioelectrical stuff, which is awesome. Are there any stretches that can possibly help?
It's a great question. I'm not a big fan of stretching. I kind of think of stretching as, just imagine like a telephone cord. And imagine there being knots in that telephone cord. And let's say we want to make that telephone cord, more functional, right? We want to elongate the cord. So we pull it tight, but what happens to the knots in the cord, Barris?
You just make them tighter.
Yeah, and, a lot of people get performance due to the elasticity of the ligament and tendon. And, I've read some of Mike Boyle's work, and what he tends to see is that when you stretch, what you're typically stretching are ligaments and tendons and not necessarily the muscle. So imagine buying, go to Whole Foods and you're buying let's say the chicken thighs, right? So the chicken thighs are inside that plastic bag. Now let's say the chicken is the muscle and the plastic bag is the fascia and the ligaments and tendons. So if you try to stretch that muscle, pull it apart while it's in the bag, what are you really stretching? Are you stretching the inside meat, or are you stretching the plastic on the outside?
You're stretching the plastic.
Right, and that's why I find it's better, if you're going to stretch, doing a dynamic type of movement stretch where you're going through a range of motion, like a high knee or butt kicks or kind of karaoke type of crossover stuff with hip movements, something that's dynamic, that's actually involving movement. That's one, because typically you don't ever just hold a movement in a sporting event, right? You're not in that position for 30 seconds at a time. It's usually you're in that position and you're out of it as fast as you are in. So that's a great way to start. And then also foam rolling, I think, is really, really helpful. And for most people, that will be good enough. And now if you're injured, This is where a technique like Graston or myofascial release or active release technique tends to be the best. I'm more of a fan of active release technique because it actually involves the patient doing range of motion. So I think it's more functional because you can restore movement and function better because you're actively stripping the muscle, which does three things. You're breaking down scar tissue, you're increasing oxygen, and you're increasing nutrition. And when you realign muscle fibers by stripping scar tissue, you allow the muscle to contract and relax better. So a lot of times if a muscle is turned off due to inhibition of the actual muscle, we'll see a muscle come back on after a myofascial or an active release type of technique. Because it's
Yeah.
literally activating that alpha motor neuron loop in the muscle fibers, which is really powerful.
Yeah, definitely. So that's the ART practitioners that can do that, right? And not that those are the only ones, but for people that just want to like maybe make a search, that's ART, right?
Yeah,
The
ART is
active
really good.
release.
Now, a lot of
Hmm.
physicians and therapists will do this technique, and they aren't necessarily certified. So just kind of ask around, look on Yelp, look on different review sites. Myofascial release is also good. Myofascial release is the same thing, except the person or the therapist is moving your hip or muscle through that range of motion, where active release technique is you, the person, are actually moving it through that range of motion. So that's the difference. But I get myofascial release, active release technique at least once to twice a month by my therapist and my chiropractor as well. Very helpful, especially if you're sitting and you know there's no way that you just can't avoid sitting, then it's great to do it for prevention.
Yeah, and that's you also do that in your practice, correct? Like I remember you were pushing down on my psoas and also in my hip flexor, and you had me rotating my hip up in that kind of that range of motion, and it was pain, and I was actually dying laughing. I'm just couldn't control it because it was somewhat painful, but it wasn't causing it was causing me to laugh for some odd reason, but it was like really deep in there, and it was like involuntary compulsions.
Very interesting. Yeah, yeah. And what happens is it's those muscles develop what's called adhesions, and these adhesions essentially are nociceptive fibers, and all that's just a big word meaning these fibers they transmit pain to the brain. So interestingly enough, you were expressing pain in a different type of way. So that's quite unique. I don't see that too often.
Yeah, it's like getting tickled. Like I don't when somebody tickles me, I mean it could get painful, but I think our bodies kind of um, have come to the point where we kind of teach ourselves to laugh with those certain kinds of things. I actually saw a thing that talked about why we laugh or why we tickle people in our neck and our bellies, and these are I guess protective areas and where they would actually teach young children how to protect themselves. So they would tickle them and they would laugh, but we naturally when we get tickled we cover these areas because they're very delicate and yeah, interesting little facts there. But yeah, definitely a great show today. Again, people get back to the basics of the movement, but I did want to ask one more question. We talked about the static stretching and um, how it's not really that beneficial. But are there certain regions that can help from it? An example, we're statically put into this. If I'm sitting, you see me right now, I'm actually standing up at my computer, but for example, maybe when I'm in a classroom and I don't have that luxury and I'm sitting down, I'm kind of in a static position where I'm shortening my hip flexors. Is there any benefit to me going into a really far lunge, uh, contracting my my glutes and really getting a stretch onto my hip flexors?
Absolutely. There's a type of stretch called a crack. No pun intended. It's contract, relax, antagonistic kinesiology. Essentially, what it is you're going in, you are lengthening the muscle, right? You're lengthening it, but as it's lengthened, you're actually pushing back into the muscle. And then you're doing that for about 5 seconds and then going deeper into the stretch. So it's still kind of a 3 to 5 second contraction. I think that can be really helpful. Like I'll do, for instance, when I do my stands up against the wall with perfect form, I'm literally, pulling myself into that position. I'm getting a stretch, but because I'm holding myself in that position, it's still an isometric type of hold because I'm trying to hold myself in that position. So it can be beneficial. I think, trying to stretch your hamstrings out that way isn't the best. I think stretching your hip flexors can be great. Kind of go into a lunge, kind of flex your hips forward as you keep your chest upright. Maybe reach your hand on the side of the leg that's behind you over. Hold that for like 3 to 5 seconds and maybe pop back into it. I'm just not a fan of going into it and really holding, but going in for 3 to 5 seconds can be really helpful, and make it a functional movement. Go into your lunge, hold it, pop back out. Go into your lunge, hold it, pop back out, or go into a walking lunge where you go in, you lunge out with your right foot, you drop in, you hold that, you pop back up, you walk to the left foot, and vice versa. That can be really, really helpful.
Yeah, and I think that's something different that I specifically do when I do these stretches, that I'm not into just a static stretch position where I'm basically just laying there pulling on a muscle, but I'm actually activating the antagonist muscle while the other one is being elongated. So it's actually working the muscle and kind of, again, back to where we're talking about teaching the nervous system, and actually more on the movement, and not just, hey, I'm just going to hold this muscle and pull it and hope that it just stays in this position.
Exactly. And then I recommend, finding a good therapist that can do something like this, that can use applied kinesiology and test your muscles, because it's really helpful. I mean, even if you just go, once every 6 to 8 weeks just to make sure you're in balance, it can really set your body up to prevent injuries from happening.
Yeah, definitely. And especially if you're an athlete, it's super important to your performance. You don't even know how good you can be. As a former fat kid, there's a lot of things that I have to overcome in order to be a good athlete. So this is like crucial for me. But there's even other athletes that don't even know how good they can be, and they can just unleash a lot of potential. And same thing, if you're in a lot of pain, like, pain is never fun, and it causes a vicious cycle. If you're in pain, it's going to cause inflammation. You might even start throwing off your food because you might crave foods that make you feel comfortable. So you want to get the pain taken away, because that's going to mess up your sleep, your diet, everything.
Yeah.
So
And remember, if you're doing the right kinds of exercise, right, explosive exercises can be helpful. Just sprinting, right, a Tabata type of interval or burst training, even if you don't know what you're doing on a bike or an elliptical, can be helpful, because it's going to just stimulate what's called a growth hormone response, which will help your body burn lots of fat and put on muscle. So let's say you don't have any skill at all. Just get on an elliptical or a bike that is going to prevent your body from having to absorb force, because there's no force being put
right.
in to the joint. It's kind of just, you're moving, you're pressing the muscle, you're pressing your the pedals, or you're pressing the steps, and there's no real force going through, like from a compressive standpoint. Like you lift your foot up, you stomp it, that's a compressive force. You don't get that on an elliptical or a bike, but you can at least push your body to the max regarding intensity, and then you can create a hormonal stimulus. So if, let's say you're worried about hurting yourself, just doing a burst type of training exercise, or a peak 8 is another one, or a Tabata style. I have some blogs on this on my website, and I think you may have some stuff as well. This can be a great way off the bat if you're totally a novice for exercising, just to start getting some of the benefits. So like this morning, I did what's called a Tabata exercise. And Tabata is named after a Japanese researcher. What he did was he took a group of 3 people. One group did 60 minutes of steady state aerobic type of exercise on a bike for 60 minutes a day, Monday through Friday, 5 days a week. The next group did nothing, and the third group did 4 minutes. So 20 seconds on, 10 seconds off for 8 sets, so 4 minutes total of an all-out sprint on their bike, so as fast as they could go for 20 seconds, 10-second rest, 8 more sets of it, only 4 minutes, and they actually had the same amount of benefits regarding aerobic and anaerobic exercise as the 60-minute group, and they also had better muscular endurance and better compliance. So 4 minutes versus 60 minutes was totally better, and if you're just starting out, set the bar low, make it really easy. Stimulate your body to make the healthy anti-aging hormones, the growth hormone, the testosterone, the progesterone, that you need to be super healthy.
Yeah, I think that the Tabata training, like if you look at the study, I think the one group that did the Tabata protocol, they also had one day out of the week where they had a a 60-minute thing, but nonetheless, they worked out a lot less. But it was mostly because they did those high intervals, and they weren't training every single day. And they, like you said, did a lot less training. And I tell you, those are some of the things that I do as an athlete, but especially when it comes to if I have a photo shoot and I'm in model season and I just need to take pictures with my shirt off, that's the kind of things that I'm going to do real high intensity at the end of my workout. But if you're just a beginner, you can make that your total workout and be just fine. And I'll put some links in the show notes or even an application that you can get. I use it on my phone. It's super simple. And just follow the beeps. And when you hear it, go as hard as you can. When it beeps, go ahead, relax, walk, or if you're on a bike, just slow it down, get it back to a 2 out of 10. But yeah, definitely a great show today. A lot of information as always. So what we're going to go ahead and do and have all the show notes available for you at beyondwellnessradio.com. You can find all the information there. And like always, great show. If you guys have any questions, please go to the contacts area. We'll be more than happy to answer your questions. Yeah, you have a good one, Dr. Justin.
Great talking to you, Barris.
Got a question for Dr. J? Go to beyondwellnessradio.com/question. Then tune in to hear the answer. Also, if you like the show, review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.